So thank you all for joining us. As Jessica mentioned, this is our third session of the Direct Care Resilience series. And today we're going to be talking about the impacts of the social determinants of health and how it intersects with mental health. So let's go ahead and begin. If I can get my slideshow pulled up here. This isn't good. Here we go. So just to give you an overview of our session objectives, today we're going to define the social determinants of health and the relationship between social determinants of health and mental health. And we're also going to outline how to apply a social determinants of health lens to the workplace. So this session is really going to provide kind of a high level overview. This is a public health concept, but it's been adopted by other disciplines to help kind of have a different lens of how we look at overall health and have a shared language among priorities for those that are making different policy decisions in the public health sector and health and human service sector. So I just want to give you a heads up that the first part of the session is going to feel a little bit heavy, but I promise we're going to have some strategies at the end. So with that, I want to outline that the social determinants of health are really based on this concept of health equity. So health equity is a concept that everyone should have the opportunity to attain their highest level of health through a fair and just distribution of resources. Health equity recognizes that health disparities are not solely the result of individual choices or behavior, but they're often driven by systemic and structural factors that includes discrimination, poverty, a lack of access to healthcare, and unequal distribution of resources. And I think that this image does a really great job at explaining the differences between equality and equity. So as you can see on the far left-hand panel, where the reality is that some groups get way more resources than what they need to view this hypothetical ball game, while others get less support, and some people are facing even more barriers to see that game than their peers because they're viewing it from a pit behind a fence. So equality is this assumption that everyone benefits from the same supports. But as we can see here in this image, that equal treatment doesn't lead to better outcomes because there's still people that can't see the game. Whereas equity really advocates that everyone gets the supports that they need. So in this case, one person doesn't need any support to see the game, while the person on the far right needs the pit removed before adding some additional supports, and then they can all view the game fairly. However, justice is when all three can see the game without support or accommodations because the barrier was removed, in this case, the fence. So what we're seeing now is efforts to achieve health equity typically involves policy changes, which includes like social interventions and healthcare reforms that aim at reducing these disparities and promoting a more just and equitable society where everyone has an opportunity to live a healthy life. So what are the social determinants of health? They're based off of health equity. And before I dive into this, I found this really interesting fact. Did you know that your zip code is more important to your health than your actual genetic code? So letting that sink in for a moment, your zip code is better at determining your life expectancy and your risk of chronic disease than your actual genetic DNA. So according to the Department of Health and Human Services, social determinants of health are the conditions and in the environment where people are born, live, learn, work, play, worship, and age that affect a wide range of health. This includes the functioning and their quality of life outcomes and their risks. And these social conditions really play a significant role in shaping health outcomes and disparities, whereas actual healthcare only contributes to about 20%. And I think recent studies are saying healthcare maybe even be as less as 10% of determining your overall health. So some few examples of social determinants, this includes employment, food security, housing stability, if you've had access to early childhood education, whether you participate in civic participation, if you experience discrimination, if you actually even have access to healthcare, and if there's like safe places to walk within your community. So as you can see by these examples, not everyone has the same conditions. That also explains in part why some Americans are healthier than others. And I'm going to play this little quick video because I think it does a great job at highlighting the social determinants. And I just realized I don't think I shared my sound, so give me a second to reshare my screen with the sound included. Appreciate your patience with
Social determinants of health, or SDOH, are the conditions that a person lives with and often was born into. These factors directly correlate to health outcomes and quality of life and result in very real health disparities for certain individuals. SDOH factors can look like lack of safe housing, unstable or dangerous relationships, loss of job or income, and addressing basic needs like food insecurity. When any one of the SDOH elements exist in a person's life, it also impacts their position within the scale of equity. Equity in health means removing the barriers that contribute to an individual not being healthy. Some people may already live in safe environments, with quality educational opportunities, with easy access to affordable nutrition, and a strong social support system. However, to arrive at that equal opportunity, other individuals will need support. Finding safe housing, securing stable employment, or access to quality food to meet nutritional needs. Addressing the issues of SDOH brings the individuals within our community to a level of equality.
So now we're going to discuss how some of these socioeconomic factors can impact mental health. Um, One of these factors includes education access and quality. There's been studies that have shown that early childhood, particularly in the first 5 years of life, impacts long-term social, cognitive, emotional, and physical development. So these studies have shown that by mid-30s, children who participated in comprehensive early childhood development and education programs have had a lower risk for heart disease and associated risk factors like obesity and high blood pressure and high cholesterols. The study also showed that quality early childhood development and education programs can play a key role in reducing risky health behaviors such as like smoking and tobacco or drinking and uh, things that lead to chronic onset disease in early or in adulthood. Also, studies have shown that people with higher education are more likely to have jobs that offer robust healthcare coverage, and that the jobs that higher skilled people are qualified for typically have better benefits um, that help reduce stress of paying for essential family needs. And finally, with language and literacy, research has shown that limited language skills and low literacy skills are associated with lower educational attainment and worse health outcomes. And the social determinants of health really impact mental health, especially with economic stability. So, with employment, for example, this includes job security, the work environment, financial compensation, and job demands. And just to highlight, we are focusing on these socioeconomic factors here in that 40% of this graph. And in 2025, there was a study that found that nursing assistants they were more likely to report depressive disorders if they worked for for-profit agencies and experienced managerial domination and emotional strain while they were at work. So they defined this as executives and managers exerting tight control over the nurses' activities to extract more labor from them. And they also found that wage-based systems that determined wage increases based on like the length of employment and the nurse's workload were linked to depression because these systems often encourage competition amongst the nurses. That generates job insecurity. It increases their workload, and we know that this all contributes to poor mental health. Another bit is food insecurity, and this refers to a limited or uncertain access to adequate food. So this could be reduced quality or variety of food. It doesn't necessarily mean hunger. Food insecurity can be caused by limited money to buy healthy food, or it could be neighborhood conditions that affect physical access to it. So, for example, some urban and rural areas may have limited access to full service supermarkets. They might be lacking transportation, or there might be a lack of public transportation that becomes a barrier for some households to get to those full fledged supermarkets that have that healthy food. Um, Another socioeconomic factor includes housing instability. So housing instability, it includes a number of challenges. This could be having trouble paying rent. This could be overcrowding if somebody is moving frequently, or if they're spending the bulk of their household income on housing. Um, it is important to note that households are considered to be cost burden if they spend more than 30% of their income on housing. So the average rent for apartments in North Dakota, it's between 500 or $850 to about $1,200 per month. And I think it's important that we take a look at the average pay for DSPs in North Dakota, which is about $33,000, or about $16 an hour. So I was curious and I just looked up the average rent in Minot and found that it's about $965. And if we look at DSP salaries, that equates to about 29%. So those are really close numbers to that cost burden range. Finally, poverty can impact mental health. So according to the 2023 Behavioral Health Data Book here in North Dakota, about 1 in 10% or 1 in 10 North Dakotans are currently living in poverty. So how does the social determinants impact mental health? One of those things is access to healthcare and the quality of healthcare. And that is also understanding when and how to seek care, which is going into that health literacy. So for the majority of these untreated or undertreated people, the main barriers to health treatment are either financial barriers, there might be a lack of mental health care professionals, there's a limited availability of mental health education and awareness. There's still definitely social stigma around mental health treatment and conditions. And there's also racial barriers to mental health care access and treatment. And I found this in that data book that shows the percent of counties without behavioral health professionals here in North Dakota. And we can see for social workers in rural areas, there's 21% of counties that don't have any social workers within that county. And it gets even more depressing when we look at psychologists. About 45% of rural counties don't have any psychologists available to them. Almost 70% don't have psychiatric nurse practitioners, and about 18% don't have counselors. So that's kind of North Dakota's biggest barrier, is the lack of mental health care professionals. Yeah. And, I mentioned that one of the barriers is finances. And at NDCPD, we do have a really fantastic program called the North Dakota Navigators, who can help with any health insurance questions that you may have. They can see if you qualify for Medicaid, Medicare, or any of the plans on the healthcare marketplace. So this is just a great resource if your agency doesn't offer it, or if maybe somebody does qualify and they just don't know how to navigate the ridiculous system that is our healthcare system. You can reach out to the navigators, and their services are free, and they will help people find plans that work for them.
And I just want to add, Krista, that they're not commissioned. They're working for a nonprofit. It does nothing for them to find an insurance or not. So there's no pressure. If you just want to brainstorm it with them, they're not going to pressure you into committing to a plan or anything.
Yeah, I appreciate that clarification. It is all grant funded. So this is just do good work. So now when we take a look at that neighborhood and built environment, if you remember from that graph earlier, that's about approximately 10%, that contributes to about 10% of someone's overall health. So in combination with those socioeconomic factors that we had just talked about, this is about 50% of your health risks can be tracked back to your zip code. So with neighborhood and built environments, we had talked about access to healthy foods. Some places may not have access to those full supermarkets, or might not have access to transportation. Some households might be subjected to crime and violence. And when they talk about that, they're talking about possibly intimate partner violence. There might be elder abuse and abuse of vulnerable adults, which is our field in the disability field. Some environments have different conditions like air pollution. Some communities are really affected by climate change and natural disasters. I know a handful of North Dakota cities, we've experienced flooding. There are some communities that have diseases that are caused by microbes and poor water quality. And now we're also seeing rises in deaths and diseases that are related to heat and cold weather. We're seeing that in Texas with the heat and the cold weather. Actually in Texas, they've just had a rough few years, honestly. So when we're talking about social and community context, we're talking about like social cohesion, and this can be a positive thing towards somebody's health. So people's relationships and interactions with their family, friends, coworkers, and community can have a really major impact on their health and well-being. So we want to see positive relationships in all of these areas because that's going to help reduce the negative impacts. You can create new relationships through civic participation. That means getting involved in different activities in your community. Some of these activities you can do by yourself, like voting, or you can do things with a group, like playing on a rec team or volunteering. And studies have shown that getting involved with community helps keep you healthier because you are able to make more friends, build trust with others, and stay active. And also being a part of these groups can give you a sense of purpose, which is a trait of resilience that we're trying to obtain with this series. Some other social and community contexts that can impact mental health is people facing challenges and dangers that they can't control. So it might be unsafe neighborhoods, it could be discrimination or incarceration. And I want to highlight that there's different forms of discrimination that can impact mental health. So there's some that happen in society, such as structural or individual. Structural discrimination, it's a systemic or institutional discrimination that refers to patterns that are embedded in like social, political, economic, and cultural structures of society. It operates on like a broad systemic level and it affects entire groups of people rather than individuals. Individual discrimination, on the other hand, it occurs on like a personal level between individuals. So this is like your unfair treatment or prejudice directed at an individual based on their perceived or actual characteristics. This could be race, gender, age, religion, or sexual orientation. Also, we know that people that have a history with incarceration are in worse physical and mental health than those that have not experienced incarceration. So I want to highlight this really great TED Talk from Dr. Kimberly Crenshaw. And I think that this does a really great job at kind of expanding our lens on the intersection of our different personality traits and attributes that we have and how that just helps how we show up in the world. So could you hear the last video okay? Okay, perfect. So we're going to go ahead and take a moment to watch this.
Many years ago, I began to use the term intersectionality to deal with the fact that many of our social justice problems like racism and sexism are often overlapping, creating multiple levels of social injustice. Now, the experience that gave rise to intersectionality was my chance encounter with a woman named Emma de Graffenried. I actually read about Emma's story from the pages of a legal opinion written by a judge who had dismissed Emma's claim of race and gender discrimination against a local car manufacturing plant. She applied for a job and she was not hired, and she believed that she was not hired because she was a black woman. And the argument for dismissing the suit was that the employer did hire African Americans and the employer hired women. The real problem, though, that the judge was not willing to acknowledge was what Emma was actually trying to say. That the African Americans that were hired, usually for industrial jobs, maintenance jobs, were all men. And the women that were hired, usually for secretarial or front office work, were all white. Only if the court was able to see how these policies came together would he be able to see the double discrimination that Emma de Graffenried was facing. But the court refused to allow Emma to put two causes of action together to tell her story because he believed that by allowing her to do that, she would be able to have preferential treatment. She'd have an advantage by being able to have two swings at the bat when African American men and white women only had one swing at the bat. But of course, neither African American men or white women needed to combine a race and gender discrimination claim to tell the story of the discrimination they were experiencing. Why wasn't the real unfairness law's refusal to protect African American women simply because their experiences weren't exactly the same as white women and African American men? Rather than broadening the frame to include African American women, the court simply tossed their case completely out of court. So first of all, Black women weren't allowed to work at the plant. Second of all, the court doubled down on this exclusion by making it legally inconsequential. And to boot, there was no name for this problem. And we all know that where there's no name for a problem, you can't see a problem. And when you can't see a problem, you pretty much can't solve it. Many years later, I'd come to recognize that the problem that Emma was facing was a framing problem. The frame that the court was using to see gender discrimination or to see race discrimination was partial and it was distorting. For me, the challenge that I faced was trying to figure out whether there was an alternative narrative, a prism that would allow us to see Emma's dilemma, a prism that would allow us to rescue her from the cracks in the law, that would allow judges to see her story. So it occurred to me, maybe a simple analogy to an intersection might allow judges to better see Emma's dilemma. So if we think about this intersection, the roads to the intersection would be the way that the workforce was structured by race and by gender. And then the traffic in those roads would be the hiring policies and the other practices that ran through those roads. Now, because Emma was both Black and female, she was positioned precisely where those roads overlapped, experiencing the simultaneous impact of the company's gender and race traffic. The law was like that ambulance that shows up and is ready to treat Emma only if it can be shown that she was harmed on the race road or on the gender road, but not where those roads intersected. Heterosexism, transphobia, xenophobia, ableism, all of these social dynamics come together and create challenges that are sometimes quite unique.
Okay, so I see that we have a question. Can you tell us if rural zip codes live longer, or is it the opposite because they have limited health care? Oh, thank you, Karen. Appreciate the comment. I don't know that off of the top of my head, but from what I've seen, I know that there's definitely more barriers to access. So I know that the North Dakota Department of Health and Behavioral Health does keep a good eye on this. So there's definitely resources out there to answer those questions. And we also do have a Center for Rural Health at the University of North Dakota that addresses this too. So there are plenty of resources to find that. And I can include that in our additional resources that we send out. So thank you so much for that question. So I know we're kind of talking about a lot of heavy topic. So I just want to take a moment to ground ourselves, because if you're like me, when you're thinking about like social determinants of health, you want to jump in, you want to fix it, you want to be able to take control of this, and that's just simply not going to happen. So I will give some strategies on how we can apply this lens, but let's just take a moment to kind of ground ourselves so that we can put ourselves in a better headspace to move forward with that. I actually had to bust this out during a meeting yesterday. I was asking for brainstorming questions, and we just did a quick little check-in. You know, we were asking people how they were, like what was on their mind, basically. And I was actually very surprised. A lot of people at our center right now are very, very stressed. And so it was like, okay, I feel like we're all like in a very heightened state because we're like letting all of our stress out there, and we're like, you know, making it known that we're stressed. So I actually had that on my doc because I was working on this presentation, and I felt like actually busting that out really helped us move forward that meeting. So yeah, Karen says after that exercise you need to spend time in nature. Absolutely. So hopefully that's helpful. That might be a tip to just have something in the background if you're having one of those meetings where it's like getting pretty heightened there. So, you know, we've been kind of talking about how work is an important social determinant of health. We know that work influences many aspects of life that affect health, income, workplace hazards, social status, healthcare access, housing, economic security, and many, many more. So the benefits and risks of work are not equitably distributed among jobs. There's different industries and workers that just don't have the same benefits as others. So some jobs, you know, they entail exposure to hazardous substances or adverse working conditions. Certain jobs don't pay a living wage. They may not have healthcare access through benefits or paid sick leave. And it's interesting because healthcare workers that are in like those lower wage categories tend to have more limited access to healthcare than those who are in other jobs, which just seems paradoxical. So like I said, we kind of know that work-life balance, all of these things within your workplace can affect your mental health. And so some indicators of good jobs are a safe and healthy workplace, income and benefits, work-life balance, having security in your employment, having a voice in your decision or in the decision making, having opportunities to gain skills, and positive employment related relationships. And I actually pulled this from the CDC, and if it looks familiar, it's because this was all what was used to help develop the Surgeon General's framework. So some things that employers could do, I mean, this is probably more in the hands of like those that are in leadership positions and HR. So you can address kind of the social needs of your employees by collecting data using like a health risk assessment tool or an employee survey. You can assess benefits designed with equity in mind. You can provide health benefits, education, and financial counseling, and review what benefits might not be offered. So is there caregiving or tuition reimbursement, to see if people are enrolled in the right benefits plans. And I'm not an expert in this area, so I provided some resources for tailoring benefits that you can check out after this series. And there's some additional resources that we can provide with our staff, maybe just hanging these up in break rooms so that people don't have to go out of their way to ask for this type of stuff. It's just kind of well known that these programs are available. So we have North Dakota Home Energy Assistance. The Working Parents Child Care Relief is a newer benefit that's offered by the state. So this involves a shared investment by employers and the state of North Dakota to offer to working parents. I believe it's a pilot program that helps offset the cost of daycare. There's also programs such as Money Follows the Person. This enables Medicaid members with disabilities to transition from institutions like assisted living facilities or nursing homes to community living. There's also North Dakota Assistive. This provides assistive technology devices and services, which is great for the people that we serve, but also if you have an employee that's needing some accommodations, they allow for you to test out different assistive tech devices before purchasing them, because assistive technology can be super, super expensive. So it's great to have a program where you can lend or loan them out and then try them before you sink all that money into them. And finally, ND Arts for Life program. This seeks to improve emotional and physical health and wellness of elders in care facilities and those living independently. And they offer intense art and artist interactions. So maybe something to try out with your programs that you're running. So I know most of you are supervisors and case managers, and I want to make the argument that understanding the social determinants of health can really help with perspective taking. In our last session, Dr. Michelle Williams spent some time talking about how perspective taking can help build trust. So for those who weren't at that session, perspective taking is the cognitive process of imagining a situation from another's point of view. This includes imagining their thoughts, their feelings, and maybe how something is impactful to them and impacting them. So now that we kind of have an understanding of the social determinants of health, this can help understand how our different experiences shape our point of view. But this doesn't mean that we should be making assumptions about our staff and our colleagues, because implicit bias is very real and it leads to stereotyping. So I would use this more as a tool for staying curious just a little bit longer and trying to dig deeper to get to the real issues that are impacting your staff, and not just assuming, oh, they come from a low socioeconomic status, so they're more stressed because they don't have resources. That's not what this is about. This is really just, okay, now I understand why you may see something in that way, because your experience has been so much different than, mine, maybe, or maybe it was very similar to yours. And so one thing we're often promoting in this series is doing regular check-ins with staff, because this gives them an opportunity to share what's going on and help build that trust and relationship. So when they do start to show those signs and symptoms of compassion fatigue and burnout, we can possibly, intervene and provide some support for them. But we know that one trap that we can fall into is falling into the role of the unqualified therapist, because it's many of our instincts to try to fix everything. We want to be helpful, but in reality, we really want to shift that process, because it's not every burden is yours to bear. So I came across this book called The Coaching Habit, which gives readers 7 questions that aim to help unlock their potential during these check-in sessions. These questions can be informally asked in less than 10 minutes, and they really try to aim to break out of these 3 circles that we often see happening in the workplace. This is creating like an overdependence on you, where you train your staff really well. They know that you're the go-to person and that you'll help them out when needed. But also that creates way too much work for you. So this helps prevent you from getting overwhelmed by the amount of work on your plate. And it also helps prevent becoming disconnected from work that actually matters. I found this really great video that kind of sums up that better than I could. So we'll go ahead and take a moment to watch this. And I hope that all these videos are helpful and engaging.
I recently read the book The Coaching Habit by author Michael Bungay Stanier. When one of your friends is in a stressful situation and they come to you for help, how do you coach them through it? Do you offer them advice? Author and world-renowned performance coach Michael Bungay Stanier says your advice is not as good as you think it is. To be a great coach, you need to spend less time telling someone what to do and more time asking good questions. There are 4 excellent questions in The Coaching Habit that you can use to help your friends, your teammates, or your employees to find their way out of overwhelming and stressful situations. I personally found that these 4 questions are actually a great way to start journaling and coach myself whenever I feel stressed. Question number 1, what's on your mind? When you ask what's on your mind, you invite the person you're coaching to skip the small talk and get to what matters. Stanier says, rather than talk about the weather or how their sports team is doing and any other superficial, boring, and simply useless chit chat, get to what matters. What's provoking anxiety? What's all consuming? What's waking them up at 4 a.m.? When you ask what's on your mind, you're essentially saying, I'm here for you, and I want to help you work through whatever's bothering you. But if you ask what's in your mind and you still feel like they're holding something back, follow up their answers with what else? What else acts like a pressure relief valve. It gives them permission to open up and allow important but uncomfortable issues to flow out. Stanier says, asking what else creates more wisdom, more insights, and more self-awareness than any other question. But there's one downside to asking what else. You may get flooded with a long list of challenges. They might tell you about those 4 projects they're worried about, the 5 people they're frustrated with, or the 2 angry emails they don't know how to respond to. It's tempting to pick out what you think the most important problem is and start offering advice. But if you tell someone what to do, you're essentially raising your status and lowering theirs by saying, hey, I have all the answers and you don't. When you lower their status, you strip them of the confidence they need to make their own decisions. So instead of deciding what they should focus on, ask them, what's the real challenge here for you? You see, when someone's stressed and overwhelmed, everything feels like a challenge. But when you ask someone, what's the real challenge here? You get the person you're coaching to pause and look inward and determine what one challenge, if resolved, would provide the greatest relief. Or put another way, what rock in their backpack of challenges could you help them remove and alleviate the most amount of stress? Yesterday morning, cleaning my house would have provided me with a mild sense of relief, but I knew that finishing this video would provide me with the greatest sense of relief at that time. I find that the real challenge is often the challenge I'm avoiding most. So the next time you're coaching someone through a stressful situation, and they insist on focusing on petty issues that you know won't matter a week from now, say, that sounds like a challenge, but what's the real challenge here for you? When you include the word you in your question, you make the question easier to answer. In a 1997 study, researchers discovered that when the word you was presented in a math question, students came to a solution faster and more accurately than if you was left out. So to help someone prioritize, ask them, what's the real challenge here for you? Once they discover their real challenge, help them develop a strategy to overcome that challenge by asking them the 4th and final question. If you're saying yes to this, what are you saying no to? In other words, if you're saying yes to dealing with this challenge, how are you going to make space to focus on that challenge? If you're saying yes to completing a challenging project, are you going to say no to useless meetings, even if saying no might upset your boss or your coworkers? If you're saying yes to being self-employed and turning that passion project into a profitable business, are you willing to say no to distractions and delete Facebook, Twitter, and Instagram off your phone? Are you willing to say no to watching TV at night and going out with friends on the weekend? Saying yes to overcoming a real challenge requires more time and energy than the person you're coaching may think. By asking, if you're saying yes to this, what are you saying no to? You're helping them strategically free up time and energy to focus on what matters. As business coach Michael Porter says, the essence of strategy is choosing what not to do. In the end, to be a great coach and a great leader, you must help others see a path forward by asking a series of questions. Ask what's on your mind to skip the chit-chat and get to what matters. Ask what else to get them to dig deep and surface challenges they might be overlooking. Ask what's the real challenge here for you to help them focus on what matters most. And then ask, if you're saying yes to this, what are you saying no to help them develop a strategy and commit to making progress. Stanier says, the change of behavior at the heart of what this book is about is this: a little more asking people questions and a little less telling people what to do. That was the core message that I gathered from The Coaching Habit by Michael Bungay Stanier. This book contains many more great questions that you can use as a leader and a coach. I highly recommend it. If you would like a one-page PDF summary of insights that I gathered from this book, just click the link below and I'd be happy to email it to you. If you already subscribe to the free productivity
We don't care about subscribing.
game
Appreciate the
email newsletter,
feedback, Karen. So here's the references, but I'm going to save questions for the very end because I'm really excited about this case presentation, and I think that this is going to offer really rich discussion. So let's put what we've learned into practice. So this case is a real case that was brought forward. So this DSP has been at the agency for 6 years. They often volunteer for additional projects and initiatives because they find the new work really exciting and motivating. They're seen as a team player, and many co-workers rely on them. One thing that we've noticed is they have been complaining of stomach pains and headaches quite frequently, and it seems a little bit out of the norm for them. There's been a lot more call outs than usual. And we know that they recently had an unexpected medical expense, and they have a GoFundMe to raise money for that procedure on social media. So you suspect that they are experiencing compassion fatigue. So I actually did this exercise with them. I did the 7 questions, and I'm curious, what do you think they said when asked what's on your mind based off of what we're seeing on this slide? Go ahead and put it in the chat if you want. You can unmute. So based off of this little bit of information we have, what do you think they said to that question, what's on your mind? Should have just had this pulled up. Play a little bit of background music so I give everybody time to put in their responses. All right, so I'm seeing a lot of themes here. Feeling overwhelmed, stressed, finances, work demands.
But if you're full, you're full.
I'm
Okay.
sorry, Katie, can you repeat that? Okay. Feeling crushed by everything on their plate. I like that. I like that a lot. So what do you think they said when I asked what else? And what else? So when I asked, and what else? Beyond what we've already put in there, what do you think is on their mind? Megan, nothing, probably looked at you like, I'm not gonna lie, that actually did happen. We have a very insightful group. We have a very insightful and empathetic group. So let's pat ourselves on the back because you guys were way more observant than, actually I had no expectations because I made this up like 5 minutes before the presentation. So, so what they said when I asked them what's on their mind, you guys were nail on the head. They're worried about finances. They said that they feel like they're going above and beyond on their projects. And they mentioned that they're starting to feel a little bit resentful because they feel like that their coworkers aren't doing anything else or as much as they are. And they've caught themselves starting to question what tasks other people are doing. And they also made a joke about maybe they should start doing a crappy job so more stuff isn't added on their plate. So then I asked, and what else? And they immediately said, I feel guilty for feeling this way. I know I can do better. I want to be well liked by people, and I take a lot of pride in people being the person that is the go-to person. So I'm feeling a lot of guilt. But they also said that they know that they're a perfectionist and they can take too long to do things. They also said that they assume that they have ADHD, but they don't have time to go and get tested. And they're also putting off uh, things like routine labs and stuff like that, and actual health stuff because of the time and the stress, because it feels like it's just too much on their plate. So I also asked them, what's the real challenge here for you? And they said that they feel like they can only do one thing well and other areas suffer. So if they put all of their energy into like one or two work projects, then home life might take a hit. So not as responsive to their kid, or more impatient with their husband. I asked them what success looks like for them. They said that well, being financially stable, being liked by everybody, and feeling respected and valued at work. But then they said they really like to leave the workday feeling like they took care of everything and that they did it well. So then I asked, how do you get there? And so they were kind of self-reflecting. Like there was so much pause and silence in this conversation. So that is really key when you were asking these questions, because there was some times where they were saying things and I was like, ooh, oh, I got a thought, I want to tell you something. And I had to tell myself, no, like just listen. So I asked them, what does success look like for you? How do you want to get there? They said that, maybe I should set boundaries. I should say no to things. And then they also mentioned that this is hard because they know that they're controlling. And sometimes when they do let go of that control, they feel disappointed with the work that's put out by others. So I finally said, how can I help? And they said, I'm going to actually pull up my notes here. They said that, they feel like they're the life raft who has to come and save things. So their team often makes comments about how valuable they are, which is really good, or feels really great, but it feels like a lot of pressure and everything falls on them. So maybe getting better at delegating things. I do want to note that when we were having these conversations, there were some things that I noticed. They expressed multiple times that they were feeling guilty. They were also noting a lot of areas that they could improve on. They had a lot of strategies that they could be employing. There were some things that I was like, okay, I know enough about certain mental health diagnoses, and I'm wondering if, a counseling session would be a good thing. But also I knew that it wouldn't be helpful to even suggest that, because why? How is that going to help in this situation? They also seemed very self-conscious when I asked directly, what do you want? It was something that I could tell hadn't been asked before. And so they struggled with it because it was like, how direct can I be? So I guess one question that I want to ask this group is, what can we do as supervisors to empower staff to feel comfortable asking for help? So in this situation, I kind of noticed that, this person was feeling guilty many times. They seemed a little self-conscious. Is there any tools that maybe we could provide them so when we are doing these coaching sessions, it makes it a little bit easier for them to come forward and ask for what they want? And I'm going to get the music going so that you guys can mull on that question. Seeing some stuff in the chat, having more routine check-ins to make it more personable. That's nail on the head. I wasn't expecting to get to, we got to a lot more issues than I expected in the first session, but I feel like if this was something that we kept going and this was just part of our regular check-in meetings, we could get closer and closer to it. I see another one, don't make people feel bad when they are asking for help. Being positive. Ensuring that you're intending the conversation when staff come to you with concerns. Don't multitask. That is huge. And actually, that's a big part of the coaching habit book is active listening. And like, we just have this tendency as humans is we're like thinking about all these, different things that are on our to-do list. You have to be intentional about sitting there and listening in that conversation, sitting with the silence and the uncomfortableness. Honestly, I would probably, if I did this session in person, I would probably have this music playing in the background just to fill that silence. This coaching was done over a Teams call, and we had our cameras off. And it worked well because I have good rapport with this person. But yeah, just making the environment comfortable. And here's one, active listening, following through with the help when requested. That is huge. We can't be saying, yes, I can do that. You don't want to find yourself saying yes to something that you can't actually follow through with. And I'm seeing another one, having more general conversations about mental health, compassion, fatigue. Let everyone know that it's not uncommon. It's nothing to be ashamed of. So they're willing to come forward and be transparent with you when they're feeling that. I'm seeing being an example, being upfront and encouraging people reach out when they're wanting help. Ooh, I like this one. Always try to remember that our team is only as strong as the weakest link. And some days I might be the weakest link and need help, but don't need to be put down because and as some other day I might be the strongest link. Okay, I like that. So some days you may be the weakest link, and that's okay. Like, it ebbs and flows. It's not, a constant thing. Well, this is great, and we are coming up on noon. So Kyle, could you please put the evaluation in the chat? I hope that you guys enjoyed this session, and I appreciate all of the feedback in the chat. This was a really fantastic session. I think what we're going to do is we're going to compile a lot of what was said, and we're going to put this into an additional resource document and send that out later on this week. And they're keep on coming. We love this. We'll download all of this and put this in those resources. So yes, if you are looking for contact hours, please fill out the evaluation form. We do require that to send those or issue out those certificates. And I also appreciate all of the kind words. We hope to see you at next week's session. Next week's session is actually going to be showing a recorded session from our previous series. I wasn't able to get Susan and Barb to come and present live again because they're really busy writing grants, and I just could not let go of, I couldn't find somebody else to do it because I love them so much. So we're going to watch a recorded session and we'll find ways to make it engaging. So we really hope that you can see that because that one is really focused on some of those supervisor strategies for facilitating these check-ins. And thank you so much, everybody.